All right, 1 p.m. here in Finland. Something else wherever you are at, but welcome to today's webinar. Greetings from Finland, and this is our first beat webinar of 2023 with a really interesting topic: how focusing on recovery first can help long COVID patients to regain physical fitness. I'm Tina Hoffman from First Beat. I'm an exercise physiologist and master trainer here, and my guest Kasper Janssen is joining me from Netherlands, and we'll introduce him in just a few minutes. A couple of housekeeping items at first. This will be a 45-minute session, and at the end of Kasper's presentation, we are going to have time for questions and answers. So if you come up with questions during the webinar, you can write them in a Q&A, and then we'll read them at the end of the session. And also, we will make a recording of this that you will get afterwards. So if for some reason you have to leave early, no worries, you'll get to hear it then later on. Had a few technical issues here this afternoon. My PowerPoint stopped working completely. So luckily I had Kasper around, and he niftily integrated my slides into his presentation. So I'm gonna have to ask him to switch the slides here at the beginning when we get going. But everything else seems to be working, so we are okay. And the topic long COVID, I personally struggled with some form of long COVID this fall. I had COVID in August, and during the whole fall, I was very, very fatigued and tired, even if I was otherwise healthy, and couldn't even dream of any kind of intensive exercise, was only doing some kind of very mild, light physical activity. And since we have a lot of Dutch listeners, a lot of Finnish listeners, and sort of an interesting story I thought I'd share from legendary Finnish football player Jari Litmanen. Many of you might know him. He was an elite world-class player at Amsterdam Ajax in the 1990s, and he has spoken very publicly about his experience with COVID. It sidelined him completely for about 6 months without not being able to do any of his normal life routines, both physically and mentally, and had extreme fatigue persisting for almost 2 years. He was in excellent physical condition when he got sick, but he said that he was not able to do any of the high effort he was used to putting when he played football during that whole long recovery process. So that, I think, underlines the fact that COVID hit some even very fit, very healthy people quite hard, and the recovery process clearly has to be handled sensitively and seriously to make sure that they can eventually get back to normal performance. But Kasper, if you can switch to the next slide, let's take a quick look at First Beat. We have quite a few brand new listeners online, so just a few words about our background. We are a company based in Finland. We have been operating in this area of heart rate variability for 20 years now, and are considered a pioneer in heart rate variability-based physiological coaching and insights. We provide solutions and analytics for both corporate wellness and elite sports. And we operate in over 70 countries today, and all our methods are based on accurate heart rate variability data. And let's take a look at the next slide and a few words about heart rate variability. The phenomenon itself, heart rate variability, means how much the time varies between heartbeats. So the millisecond level variation that occurs from one heartbeat to the next. And this is mediated by the autonomic nervous system, and in a way it gives us a window into the sympathetic and parasympathetic parts of the nervous system, with sympathetic being the activating or mobilizing part of the nervous system that keeps us going and lets us perform, and then the parasympathetic is the part that calms us down and allows the body to recover. And in a healthy situation, both systems should be operating in some kind of a balance. And in that way, we use First Beat, or we use heart rate variability as a window into this system and into the underlying processes that are going on in the body to tell us about, for example, stress and recovery. And then the next slide, a few words about First Beat Life, which is a personal health and wellness solution, and also a coaching tool that includes a highly accurate heart rate variability sensor. Looks like this. It's called a Bodyguard 3. It measures every heartbeat very accurately, both during rest and during exercise, any kind of activity, all day and all night. And then in addition to that, the client has a mobile app, First Beat Life mobile app, where they actually get their results and they can see how different kind of daily behaviors were reflected in their physiology, and they can make learnings based on that. So we go from the heart rate variability data and then come up with information about stress and recovery balance, recovery during sleep and exercise, and then different kind of personal insights from that. And in this process is, for example, in recovery from an illness or from overtraining or something like that, the coach's role can be really crucial, the doctor's or the coach's role, to make sure that right kind of conclusions are drawn from the result and not over dramatizing it, but at the same time really learning what the data is telling about the person's situation. And the next slide gives an example, very familiar to many of you, I'm sure, the red and green and blue first beat graph. The idea here being that the red color is the sympathetically dominant state, energy, or activation. It belongs to life. We all have that during the daytime. But then to balance that off, we should also have green, which is the parasympathetically dominant recovery state. And while we are monitoring different kind of wellness programs, for example, or recovery projects, then this is the balance that we are always paying attention to see if the client is actually able to recover from the exertion that they are doing. And since today's topic has to do with sports and exercise and ability to get back to exercise after some kind of an overload or illness situation, you can see the blue exercise bar here, and that's another thing that this kind of a coaching can focus on, to make sure that the client is, even if they are healthy, that they are not exercising too hard, but particularly when they are, for example, suffering from an illness or are not well recovered, to make sure that the exercise doesn't actually become an additional stress factor that makes the situation even worse. It can prevent recovery almost completely, and with the right kind of monitoring, the doctor or the coach can get a good idea of how well that recovery is progressing. And I think we'll see some interesting examples and hear a little bit more about that from Kasper. But before that, let's take one look at our big data. This was a recent finding from our data. We gather this kind of data from hundreds of thousands of measurement days from around the world, and our data analysts then can find interesting trends from there. And this was quite a striking finding. We were looking at the number of people in poor fitness category. We use a 30-minute walking fitness test that we can estimate a person's VO2 max. And then when we looked at the two lowest fitness categories, we can see quite a noticeable increase during 2022 in the percent of people who are in the very lowest fitness category. It stayed fairly stable over 2022, 2021, but then significant increase. And we are still in the middle of speculating what all might have caused that. We are guessing that some of it might have to do with COVID, long COVID recovery, where people's fitness is dropping because of the illness itself. We are also fairly certain that at least one explanation is that when COVID first hit, we all had to stay inside, we couldn't go anywhere, and people's physical activity levels dropped quite dramatically. But fitness doesn't drop right away. When we stop exercising, it takes months or maybe even a year before that kind of passive lifestyle really starts to show up on the VO2 max. So perhaps we are seeing that more passive lifestyle with a delayed result. But obviously, it's something that all of us working in fitness and health and well-being, we need to work on that with our clients to make sure that they get back into that active lifestyle as long as they are healthy. So we thought this was quite an interesting finding. But at that, I would like to welcome Kasper Janssen on stage. He's a sports and exercise physician. He works in the Netherlands, and he was actually a guest speaker at our HRV summit in Helsinki a couple of years before the pandemic. He was talking then about the value of power naps. And we have been in touch since then and have had interesting conversations before. And it's great to be working together again, Kasper. And I would like to give the stage to you now and welcome you to start your presentation.
Thank you, Tina. Thank you, Tina and First Beat, for inviting me to present this webinar on how focusing on recovery first can help long COVID patients to regain their physical fitness. So I'm an athlete, of course. If you are a sports physician, then you need to participate in sports. And of course, we Dutch like to skate. So this was during a skate session on the canals with a friend of mine in the Netherlands in January. So we have proper winter too here in the Netherlands. So I work as a sports and exercise physician in my private practice in Utrecht. I also perform the PhD in the Sports and Lifestyle and Health Research Group of Amsterdam University Medical Center. And I give advice on power napping at work to improve performance and health in workers. I actually wrote a book on power napping, but it's in Dutch. So, but maybe for the Dutch listeners, the power nap paradox, if you want to know more about power napping for improving your recovery and performance. So the content of these presentations, I'll briefly explain the background of COVID-19, some long COVID systems, and how you can use CPAT, which is an exercise test for guidance in heart rate pacing in long COVID patients. I show some results of a small study in my practice. It's called COVID rehab. And then I'll go into some cases where I can show you that focusing on recovery first is actually really beneficial for a lot of these patients. So briefly about COVID-19. Of course, there's been a lot of research, and this is a really recent summary, a review article, Long COVID, Major Findings, Mechanisms, and Recommendations. It's interesting because I think they provide a nice overview of the main symptoms people have and also the main organs that are possibly damaged by the COVID virus, or at least some problems can arise. So of course, a lot of people complain about palpitations, a cough, neurological symptoms, and of course fatigue. So it's apparent that COVID can actually affect a whole series of organs. And we know that it happens via the ACE2 receptor, so that COVID is able to enter all these cells via ACE2. But to get you in this webinar, I thought it would be nice to do a few good mornings because we are sitting all too much together. So please stand up. And this is one of the exercises I always did with the rowers, the national rowers team, while warming up for their training. So please stand up. Tina is providing you the right example. It's easy to perform a good morning. The picture is shown there. You just make a squat and you lift your arms. About 10 would be good to get your physiology going. Tina is showing the way to do it. Very good. And yeah, it's good to get those muscles warmed up. So I'm staying down because I'm already presenting, but really well if you all try to get your physiology going. So a brief quiz. You can keep on standing if you think I've been sitting too long. If you have the wrong answer, do 5 extra good mornings and please sit down again. So we can continue the webinar. So I'll show all the answers to the statements during the webinar, and please ask afterwards if you think some of these statements haven't been explained well. So the first one, when exercise training is based on perception, so like a Borg score or rate of perceived exertion in long COVID, the CPAT is not necessary. Do you think yes or no? So do you think an exercise test is necessary if people already use the RPE score during their exercise? Now see coming in all your answers. Take a few more seconds. And Tina, am I correct? Will you show the poll results right away?
Yes, I can get, do you want one after each question or in the end?
Maybe it's nice to see what people say right away. Yes.
Yeah, looks like about 80% think that no, it's not necessary. Only 17% say that yeah, it's necessary.
Okay, great. Thanks a lot. Okay, so in my opinion, it would be advisable to do an exercise test if people are having difficulty exercising. Okay, I'll show you later on. So if you said yes, keep standing up. If you said no, you can sit down now. So the second one, can I stop the poll? Is that okay?
Okay, you don't want the second question?
Yeah, I was trying to get to go to the second one, but it didn't work.
Yeah, the listeners have already have gotten the 3 questions.
I'm sorry.
Yeah.
Okay. So the second question, every patient suspected of long COVID should have a test for autonomic dysfunction.
And actually, they've already had a chance to answer that. And so 86% said yes, 14% said no.
Okay. If you said yes, you can keep on standing up. And the third, long COVID patients can improve their physical fitness with lifestyle advice. Would you agree or wouldn't you agree?
That's 100% agree. So I think people are starting to
Great.
get in with your presentation.
So if you're still standing up and you would like to receive a copy of my book, it's in Dutch. So please provide your details in the chat if you think it's okay to provide them in the chat, or just say, yes, I would like to receive, and Tina can contact you afterwards. Well done. Thank you. Everyone can sit down now. Thanks for taking part in this short quiz. So back to COVID-19. It's apparent that the virus affects a lot of our organs, but we mostly forget that the virus can also affect our muscle. And this is really important, as muscle is, of course, important for activity, but it's also important because you want to increase your condition. And what was really striking for me at first was that some research showed that actually the diaphragm, our most important muscle for breathing, was affected by the virus directly. So it was apparent on ultrasound, but it was also found even in Dutch research that people who had severe COVID really had muscle damage of the diaphragm. And of course, breathing is really important for your basic energy metabolism. So a lot of people show a dysfunctional breathing pattern, and it could be partly because of damage to the diaphragm. But of course, only a low percentage of these patients are hospitalized, and most of these patients have only a mild infection. So they are maybe bedbound for a few days. They do have increase in muscle mass for lying in bed about 3% per day. They're still fatigued after a few months, and usually in the Netherlands, only after 3 months in primary care, some of these patients are referred to a sports medicine, medical doctor or for rehab. In the Netherlands, sports physicians do diagnose of musculoskeletal, cardiac, and pulmonary problems. Of course, if you have more psychological and neurological problems, those patients can also go or should go to a rehabilitation physician in the hospital. In the program or in the rehab that I provided to these patients, we perform a CPET, cardiopulmonary exercise test, to see if there's a limitation with exercise. Is it the heart? Is it the lungs? Is it muscle function? Is it breathing? So maybe hyperventilation, which is apparent in a lot of these patients, or maybe even movement anxiety. People are uncertain about their body, are uncertain about exercise. And then how about recovery? Because we performed this test, but a lot of people complained about post-exertional malaise. And at first, this was not really well recognized. So I think by performing the test and by exercising these patients without limitations, we could have made things worse in the beginning. But when we started to recognize in my practice, it was after maybe 2 months, I started to recognize that there was something wrong. Something was different about these patients. So they had a lot of complaints about fatigue. And it was really important to notice. But first, what do you actually do with an exercise test? So it's a bicycle ergometer test of maximum of 15 minutes. We perform a breath by breath O2 CO2 gas analysis. We measure spirometry, a heart film. Of course, you look at heart frequency, breathing frequency, blood pressure, VO2 max, maximal oxygen intake. And this is really interesting, the ventilatory thresholds. So during exercise, you start breathing more heavily, and you can actually look at the breathing pattern and discover when people are building up lactate in their muscle and when they start to ventilate more heavily. This is a really important point that you can actually use in the feedback about exercise. And just to show that, a lot of patients are seen in my practice, not only athletes. This is a master athlete, 81 years and still going strong, not having COVID, but just to show that CPAP is performed on a lot of different patients. So if you look at some CPAP results here, it's of course only a brief summary. So if you're not familiar with CPAP, you can see the ventilation on this axis and exercise on this axis down here. Then we look at the minute ventilation, and you can see that there are 2 points where the curve is going more steep, and those are the first and second ventilatory thresholds. And with long COVID, we see that the ventilatory threshold is a lot lower and is reached a lot earlier than in non-patients. So I performed a brief study on a section of these patients together with a student from the Free University in Amsterdam. And this was also presented at the Dutch Sports Medicine Conference last year. So what we did, we looked at the rehab, the COVID program that I performed. We performed the CPAP at the start, and we performed an evaluation after 6 weeks, and then a second CPAP after a mean 12 weeks. So the rehab advice was performed by a sports physician, and the training was guided by a physical therapist. We included, we started with 49 patients, but only 26 were included in this study because of missing data or other problems. And then I performed an advice. So we divided the groups in a group that received less training, so the less group. So these patients focused on recovery, had a shorter training time, had a lower intensity of training, a heart rate below the first ventilatory threshold. And the more group received more training. So they increased the frequency of their exercise, they increased the duration of their training, and they also increased the intensity, but still below the first ventilatory threshold. So this was used as heart rate pacing. So the goal was to evaluate the results after 12 weeks. What is the effect of rehab advice? Train less or train more on VO2 max. And we hypothesized that an improved VO2 max would be evident in both groups, and the more group would improve more in VO2 max. Of course, this is only very brief results on the VO2 max. So you can see the relative VO2 max in milliliters per kilogram per minute on this axis. And you can see the both groups. The less group, so they trained less, is in blue. And the more group, so they trained more, is in orange. And what is really apparent, what is interesting, is that the less group was actually fitter at the start in general, but they improved less, which is of course logical if you train less. But then interestingly, the more group was less fit at the start and improved more after 3 months on the second CPAP. And of course, this was not a real RCT, so it's only looking at a group of patients in my practice retrospectively, but still it can provide interesting insights. So what we saw is that the train more group significantly improved their VO2 max. There was 100% responders, and the train less group had no significant improvement in VO2 max because there were 50% non-responders. So only 50% of the patients improved. So could it be that the less group, as selected by me as a sports physician, has a worse prognosis? We performed a regression analysis, which is only a small number of patients, so you have to take in some precaution in interpreting this result, but all the women in the less group had less improvement in their VO2 max. So we concluded that a guided rehab by a sports physician and a physical therapist was successful in most, namely improvement of 14.8% of the VO2 max. And it was rehab based on the CPET, including heart rate pacing, based on the first ventilatory threshold. And it's effective improving the physical fitness in long COVID patients. But possibly, as a sports physician, I'm able to select the patients with a worse prognosis. So in this case, the less group. And could it be that if we add focus on recovery, that this could actually help these not recovering patients? So I will provide you a long COVID case. Mrs. A, she's 50 years old. She's a policy officer. And on April 2nd, 2020, she was tested COVID positive. So this is her story. After 8 weeks, I was negative and therefore I posed no longer a risk of infection. However, my complaints persisted and some even got worse. I'm back to work, but the biggest problem is a weak physical condition. I tried exercising, but my RPE with light exercise remained high and post-exertional malaise is devastating. For me, this is a typical patient with long COVID. And briefly to talk about, because that's what we asked in the quiz as well, symptoms of postural orthostatic tachycardia syndrome. I think for all of you, this should be really recognizable. And how can you easily diagnose this? It's a sustained increase in heart rate of greater than 30 beats per minute within 10 minutes of standing. So you ask these patients to lie down for 10 minutes, you measure their heart rate, and you also measure their blood pressure, and then you ask them to stand up and you keep measuring heart rate every 2 minutes and you look at what happens to the heart rate. Of course, there are a lot of buts, but that's probably for a doctor, but if you are in healthcare, you should be able to perform this simple tests. And people complain a lot about lightheadedness, pain, nausea, and fatigue. This is all connected to POTS. So back to Mrs. A, she didn't have POTS, so also performed the test, but she didn't have POTS, but she did have post-exertional malaise. And this is her exercise test. So if you look at this axis, you can see in red her heart rate going up during the test. It was a step test. And you can see that she only reached about 120 watts here in gray. And then you can see that she only had an oxygen uptake of about 15 milliliters O2 per minute per kilogram. Of course, I understand you don't all perform CPAPs, but if you know that you need about 13 milliliters for your activities of daily living, then you can understand that she really was limited in her activities. If we then look at the ventilation curve, you can see she was hyperventilating. So on this axis, you can see the number of breaths per minute, and she was almost up to 30 here, while normally you only need 10 or 12 breaths per minute. And then during exercise, of course, her breathing pattern increased. And if you look at, this is a very simplified version of looking at VT1, but still we show you that if you look at the ventilation and you make two lines here, then you can see that at this intersection, the VT1 is at a heart rate of about 125 beats per minute. And you can use this ventilatory threshold as an upper border for exercise. So if we translate this CPET, then her blood pressure was within limits. She needed to stop exercising because she was out of breath. She had a first ventilatory threshold of 125 beats per minute, and her recovery was delayed because of post-exertional malaise. She also had DOMS, delayed onset muscle soreness, muscle pain, longer than 2 days, which is abnormal. Normally, you should recover within 2 days. So all these things were apparent, as with a lot of long COVID patients. And then if you look at the program that we normally provide, then we combine endurance with HIIT and strength training. But what I saw in these patients, that actually HIIT and strength training was too intense. People had more post-exertional malaise, people had more difficulty in recovering. So I decided to give these patients advice on breathing exercises, rhythm, sleep, and nutrition first, before introducing more strenuous training. So this is just a brief view of how patients can experience such a test. She said there was an open and honest conversation. More and more is becoming clear, but no one really knows how the further recovery will go. Sports doctor is a designated specialist to be able to guide this process and the recognition of the many complaints, because doubting yourself is a real threat to your identity. That was the way she experienced this. And during the test, many bodily functions are monitored and measuring is known. I now know my limits during exercise, 125 beats per minute, and am regaining trust in my body. This is, I think, one of the factors that maybe is overlooked, that people, when they have post-exertional malaise, they lose trust in their body. They think something is wrong and are not able to exercise at all. And then performing a test and rebuilding trust, making the limits apparent is a really helpful thing, in my opinion. So why recovery first if people are not recovering in a normal rehab program? Well, this is again a figure from the study on long COVID, the major findings. It's a review. And of course, we now know that we have immune dysregulation. So there's a reactivation of underlying pathogens like EBV and other viruses. We also know that our microbiome plays a big role. So SARS-CoV can have an effect on the microbiome and can have effect on complaints of the intestines as well. There's autoimmunity and immune priming. I won't go into details about that, but for me, I think it's interesting to look at blood clotting, because at first, Reza Pretorius, a professor from South Africa, she was the first to see that this was happening in these patients. And then I thought, okay, this connects to what I see during the CPET, namely that not enough oxygen is going through the muscle and not enough oxygen is transported to the muscle, which is actually what is explainable if you know that there are endothelial abnormalities. And then the last part, and maybe most interesting for me, at least for this presentation, is that there's dysfunctional neurological signaling. So there's a dysfunctional signaling in the brainstem and or the vagus nerve. And this is interesting, but because we can actually measure the activity of the vagus nerve. And maybe we were a bit slow of actually looking at this in more detail. So let's do that now. Because when recovering is delayed, HRV, heart rate variability monitoring, as explained by Tina, is a really good way to look at our recovery. This is an example from body resources, which is one of the figures provided by the first beat measurement. And you can see that the body resources at the start are okay here and then are dropping during the measurements during these 5 days. So during the daytime, your body resources decrease. You can look at it as like a body battery, which is one of the functions in, like, for example, Garmin watches. But this is sort of the body resource at the start. You can see it dropping here and you can see it gaining again during the night. but here it drops and there's not enough gain during the night. So slowly people are deteriorating. Recovery is impaired. Back to the patients, back to Mrs. A, because what happened during exercise? Can we prevent them? If you look at her figure here, and you can see on this axis the heart rate, then you can see that at this exercise moment, she is having a heart rate of about 150 beats per minute, and she's exercising for 15 minutes. Then you can see that she is recovering slowly. She has a lesson in photography here, which is really good. But then during the night and during the evening, you can see that she is not recovering well. So normally this would show up green here, stating that the nervous vague is more active and you have parasympathetic activation. But in this case, there are still sympathetic activation. So she's not recovering well during sleep because of too intense exercise. This is what I see a lot in these patients. One of the other effects you can see in these measurements is the effect of alcohol. So here again, we have an exercise in the morning, which is not that intense because she is only reaching about 130 beats per minute here, but she is exercising for 3 hours. So the duration of exercise is probably too long, it's still too intense. Then she has some relaxation here in the afternoon, but she decides to have a nice evening out with friends and she drinks 6 beers. And what you can see, what's really apparent is that the sleep is even, the quality of the sleep is even less here during this measurement. So she is having almost non-parasympathetic activity during the night. There's not enough recovery to recover from this exercise. So alcohol hinders direct muscle recovery, but it also decreases sleep quality. It decreases, I'll show you in the next slide, deep and REM sleep. So to conclude, there's suboptimal recovery. She should start heart rate pacing and always go a little bit below VT1. So I said, please keep your heart rate below 120. Maximum duration of exercise 20 minutes, which is a good way to start. And then stop drinking alcohol for 3 months because your liver function will return to normal after about 3 months, and the amount of deep and REM sleep will improve. And what's not known by a lot of people is that actually growth hormone, so in the brain, growth hormone is pulsatile going into the blood during sleep, and it actually improves muscle and tissue recovery. So there's an improved physical recovery if you can increase the amount of deep and REM sleep. Well, that's a lot of information. How does it show if she tries to focus on recovery? Well, it's in this measurement, it's really clear. So she is maybe looking a lot of TV in this day, but still she's trying to limit her exercise, so staying below 120 beats per minute. She has performed some chores, some householding tasks, and she has provided some exercise here in the afternoon of about 20 to 30 minutes. Then she has a break. You can see activation of the parasympathetic system here again in the afternoon. Again, some TV watching, relaxing, and really trying to wind down during the evening. So she has a better night here. Winding down, so the second night, you can see having a bedtime routine improves sleep. So again, she stays below her first ventilatory threshold of 120 beats per minute. So here you can see the result of the first beat life measurement is really showing improved recovery. What do we do with the patients that don't recover? Okay, we can focus on recovery, but then if it doesn't work, please look at the NICE statements for chronic fatigue syndrome, deal with the stigma. So graded exercise can be harmful, show compassion with these patients, and refer to a sports or rehabilitation physician if the rehab is not working. So in my opinion, a CPAT can really help because it can help in heart rate pacing, showing the limit for exercise, and of course, then focus on recovery first and then on training. Thank you.
Thanks, Kasper. Really interesting data, and I'm sure especially for the sports physicians and exercise physiologists online, there was some really interesting information and things that maybe we have seen, but not quite as clinically and not with as detailed data. So very, very interesting. I have some questions in the Q&A and also a few that came ahead of time, but I was going to ask you just on a general level that what has been your experience or key learning when you've utilized HRV data, not specifically to COVID, but in general, what's the key learning that you have had from utilizing that kind of data?
Yes, thank you. That's a real good question because the different patterns are so clear. You can see that when people exercise too intense, even if they don't have COVID, that they forget that recovery is also important. So also athletes that train really hard sometimes forget how important recovery is. So they don't focus on sleep, they only focus on training enough. But then I said, well, if you train hard and you forget to recover, you won't get fitter.
Yeah, good. There's a couple of different questions about what about with this disease or that disease, and I, at the risk of knowing that this might be a tough question, but how much would you say that those basic principles, what you learned from this long COVID study, can be generalized to recovery from other kinds of illnesses?
Okay, this is a really important one. I always explain to my patients that the live HRV measurement is not about diagnosing any disease. It's about looking at lifestyle, looking at stress and recovery. And looking at stress and recovery can be beneficial in a lot of different circumstances. But of course, if there's an underlying disease, then it's always important to look at the underlying disease first. So for instance, if you have a low ferritin in your blood, then you can have fatigue because you don't have a high enough hemoglobin, for example. So then you need to start using ferritin. But then muscle recovery can be low as well. So it's only looking in general, like as a helicopter view on the lifestyle of the patient. So it doesn't provide a diagnosis, but it does provide insight on how to improve recovery.
Yeah, true. Can you please, Kasper, put the final slide just so people can have the contact information from there, but we can take a couple more questions. We might go maybe 1 minute or 2 minutes over time, but that doesn't matter. But I think that's really interesting. And I also would say that, for example, we have seen with burnout clients that if you have had serious burnout and are coming back from that, the importance of only very easy exercise, it's absolutely crucial in that. Burnout often happens to people who are very high performers and tend to overdo things on all aspects of their lives, and hard exercise can absolutely be detrimental for that recovery. And also there, that kind of monitoring of the recovery process and making sure that it's only easy activity while the situation is going on, that can be quite crucial in that as well. There's a question here that what are your key clues that you get from First Beat Live if somebody is overdoing it when they start exercising again?
In First Beat Live, you can actually see that overdoing it takes more recovery time. So people can see in their timeline that when they perform low intense training, they recover within 2, 4, or a certain amount of hours. And if they have a more intense training, then they maybe need even 1 or 2 days to recover. And this pattern becomes really clear as I showed in the body resources. So the measurement overview over a few days. This is a really useful item. And of course, because Garmin also has a connection to First Beat, I think the body battery function in a lot of Garmin watches can be really interesting. Of course, always look at it as a a way of helping people with recovery. It's not the truth. So you have to interpret these results carefully.
Yeah, really good point. I also always highlight that ideally you have some kind of baseline data from that client, that from any kind of initial measurement, it can be tough to draw conclusions just because the recovery is bad. But then when you accumulate some data over several days and maybe over different kind of days, then if you start seeing that pattern that recovery is getting worse and worse, or particularly after exercise, that like those were really striking examples that you had from your case client, that the recovery was, even on the night when she didn't have any alcohol, the recovery was really bad and heart rate was very high during sleep. Let's take one more question, and then I think we are out of time. There's a couple of comments that interesting. We are interested to do this study in France. We'll be in touch with you, so you might get a few contacts from people who are interested to replicate the study in their countries. But do you in general find that people with long COVID have persistent sleep problems, not only in the data, but do they also have trouble sleeping?
Absolutely. Not being able to sleep is a real important factor in long COVID, and always look for obstructive sleep apnea, because sleep apnea is really common in general. And in long COVID, if people have sleep apnea, so if they have an obstruction of the airways during sleep, they snore, they have breathing stops, always ask if the partner maybe has noticed this. If you can treat this in a long COVID patient, you really help this patient with his or her recovery, because sleep apnea can be a really difficult thing to come over and to improve your recovery. So you have to get it treated.
Yeah, great. Well, I think we're out of time, so we're going to stop here. But thanks, Kasper, for your insights and interesting data. And even for me personally, I think I intuitively knew that I couldn't do hard exercise for several months because it just felt bad. But if I had been training for something or had a more systematic training program, it would have been really easy to try to just push through it, because that's what a person is often used to doing it. So it is really valuable to have that insight, that how important it is to pay attention to that. Thanks for the participants. We had a lot of people online from all around the place. And if you have further questions about First Beat Live or how to utilize that, feel free to contact us here at First Beat. And you can also get in touch with Kasper if you want to discuss this specific topic more. But thanks for joining us, and thanks, Kasper, for your expertise. And we'll have another webinar coming up here in a couple of months, so you'll get some information about that soon. Have a great day. Take care.
Thanks a lot, Tina. Bye-bye.
Thank you. Bye-bye.